I'm not crazy, not stupid. I'm happy with this look. It's the prettiest monster you have ever seen, no?
How do we fix this mess? The truth is, when I look at this lady, I feel a harrowing sense of regret on her behalf. But it points to a much bigger problem that we face in our industry. With all the best knowledge, all the best techniques, and the very best products in the world, you could still create awful results. There's a missing piece in medical aesthetics, and I'm going to reveal it in this video. This person is seeking to be what she calls a beautiful monster. But the truth is, many of our patients actually tread the same path without actually trying to get to this state. The truth is, in most clinics, patients dictate the injection points. They ask clinicians for a lip procedure or a cheek procedure, and most clinicians do a brief assessment, rule out medical risk, and then do the procedure the patient has asked for. If you play this out over time, something really important happens. Your patient who looked great after the first and the second treatment starts to seep slowly into looking like a caricature of their former self. Just imagine treating this patient with a little tweak in her cheek, just 0.5 ml on either side, and she wants the same feeling again in 6 months' time. So the injector repeats the same technique. Once again, the patient is happy, she looks a bit more edgy. The process then continues every 6 to 9 months with the same safe injection technique given to the patient, who is so thrilled from her first result that she keeps thinking a little tweak again will give her that same exciting feeling. The new fuller cheeks, more definition, more shape, and it creeps up over time. She's looking more and more unnatural. We have this empty space underneath cheeks, this great curvature above leading to the forehead. The temples now look emptier than they did before. There's a distraction, a pulling of attention away from her eyes because the cheeks are so much larger. There's so much extra surface area. She may then decide maybe a little bit more jaw definition would help as well. And this is what you can see in our case study. Where in your aesthetics training are you taught how to make a decision about when to stop? What are the components of a chin, a jawline, a cheek? How does it fit into the face? Naturally, so that as you inject, you create more beauty rather than less. Because unfortunately, that is the process that produces unnatural, unsettling, almost harrowing results over long periods of time. We need a framework that teaches us not just about the proportion or the techniques used, but about the actual shape and detail of different elements of the face and how it all works as a whole. The individual components, the most projected points, how those points are connected together, and the planes that make up the surface of a human head. When the injector understands the desired three-dimensional shape of each part of the face, you can start to assess in much more detail. Do we need to add more volume or less volume? Do you want to make a particular point project more outwards, or do you want to blend it in so that it's less dominant in the face? The missing piece in medical aesthetics training is the ability to diagnose the aesthetic potential. This is the gap between where a patient is and where they could be, because if you can diagnose that gap, not only is it useful the first time you see your patient, but it's useful in managing them over a lifetime. It gets harder the longer you see patients. You cannot rely just on the common patterns of aging. You need a framework to assess each point systematically to keep everything in balance. Over the last 4 years, I've looked in depth at the structure and shape of the human form in 3 dimensions from an artistic-only perspective. And I'm applying this to medical aesthetics. If you would like to learn my framework, click the link in my description for more information.